for the day, for day one of our conference. So I am pleased to introduce Dr. Stephen Gaetz, who is a professor in the Faculty of Education at York University in Toronto, Canada. He is the president of the Canadian Observatory on Homelessness and the Homelessness Hub at York University, as well as the scientific director of Making the Shift, Youth Homelessness Innovation, Social Innovation Lab. Dr. Gaetz works in collaboration with partners to conduct research and mobilize this knowledge so as to have a greater impact on solutions to homelessness, and in particular, the prevention of homelessness. In 2017, Dr. Gaetz was awarded the Member of the Order of Canada. So I'm now going to turn it over to Dr. Stephen Gaetz, and if anyone has any questions, please just remember to put them in the chat, and we will address them at the end of the presentation. Stephen.
Thank you. Thank you for the introduction and that powerful story of someone with lived experience that captures so many of the dynamics that go to helping us understand the relationship between homelessness and extreme poverty and involvement in the justice system and people with substance use disorders. I'm going to put up my screen here to share, and at the end we can have questions. There we go. Okay. So you can see the title here. This is what I'm going to discuss. I've been doing, I used to work in the homelessness sector in the 90s, worked for the City of Toronto for a while, but I've been doing research since the 90s on homelessness, its causes, its conditions, and the solutions to homelessness. And so I'm going to focus a bit more on youth homelessness because that's where a lot of my research has done. But I want to just start with the context. Youth homelessness, in fact, homelessness writ large is often seen as an intractable problem in Canada. You know, that we've always had homelessness, we always will. It's something we just have to live with and, in a sense, put up with. But the reality is that modern mass homelessness really emerged in Canada in the late 80s and 1990s. For those of you who would be my age and were around at that time, you noticed a big difference, a big transformation as we started to see more and more people on the streets while we were de-investing in housing and cutting back social services and supports, that kind of thing. And so homelessness has grown. We're working to deal with it now, but I want to talk about that a bit and why maybe we're not doing as good a job as we could. Some of the data I'm going to give you here is from this report we did, the first national survey on youth homelessness in Canada, and some of it's quite compelling. So this piece of data here to me is one of the most important things we found from the study. Of all young people who experience homelessness in Canada, 40% had their first experience before they're 16 years old. And the tragedy in this country is that in most jurisdictions for those young people, we do nothing. There are no homelessness services if you're under 16. And that group is characterized by a lot more early childhood trauma and abuse and neglect, problems in school, involvement in child protection, etc. So they're by the time they're 16, a lot has already gone on that kind of sets people up for potential problems. This is an important thing too. In Canada, about 0.3% of young people are involved in child protection. Amongst young people experiencing homelessness, it's 59 or 58%, right? So transitioning from care is a pipeline to homelessness for many young people. You know, it's your 18th birthday, happy birthday, here are your clothes in a shopping bag, a plastic bag. And that's a problem not of the young people, it's a system failure that is producing the homelessness. We know well from research that prolonged exposure to homelessness has a profound impact on mental health and well-being. In our study, we found that 85% of young people were in the high symptom distress category, which if you applied that to the Canadian population, that would mean that people are either in inpatient or outpatient mental health care. And as many of you will know, that when people experience homelessness, getting access to mental health supports is a huge challenge. Criminal victimization. Now, this we're going to come back to later, but we often frame young people who are homeless or adults as the problem we need to solve, that make us unsafe in society. But we know from research that young people who experience homelessness are exponentially more likely to be victims of crime than to be perpetrators. But yet our policing efforts in many jurisdictions focus largely on framing the young people as the problem. There's young people are at risk of exploitation and sex trafficking. As you can see from this data here, nearly 1 in 5. This is from a study by Covenant House International. 1 in 5 young people who experience homelessness report being trafficked. When they were doing this study, they spoke with young people at Covenant House in Toronto, which is an emergency shelter and transitional housing program. And they asked young people inside the building, have you ever been approached to work in the sex trade? So while you're inside, has this happened? And almost every young woman said yes. Because what happens is that pimps and their proxies, the young woman that they're forcing to work, will go into the shelters to pretending that they're homeless for the purpose of recruitment, right? And this kind of points to a big problem with our focus on emergency services, because when we warehouse young people who are homeless, we're essentially putting a big neon sign on top of the building that says, here they are, come and get them. And it points to the fact that as well-meaning as that emergency response is, it's not enough. Now, a lot of what I've just mentioned, the trauma, the criminal victimization, the mental health challenges, in addition to physical health challenges, leads to higher uses of substances. And all of you are greater experts on this than I am, but we can understand the relationship between trauma and substance use disorders. And, it doesn't surprise me in a way, right? Like, I've never personally been homeless, but I kind of figure that if I were, I think there are 2 things that I would probably do. One is I would probably use substances a lot more than I do now to take away the pain. And the other thing I would do is get myself a big, mean dog for personal safety. And I don't even like dogs, but a cat doesn't quite offer the deterrent effect that I'd be looking for. So we shouldn't be surprised that people experiencing homelessness often, not all of them, right, but often use substances. And the challenge is that whereas I can go into this is my home here. If I want to use substances, legal or illicit, I can do it with a fair assurance that nobody's going to know. Or probably nobody's going to care. But when you're homeless, most of your life is spent in public or semi-public contexts. So if you want to have a drink, you're sitting in a park or a street or alley. If you want to use illicit substances, it's in public. And that is one of the things that leads to a lot of involvement with the criminal justice system. That we force people into public places and spaces where they're under more surveillance and more likely to come into contact with law enforcement. So we also know that pathways off the streets, that young people, after they're exposed to homelessness, when they leave homelessness, it's often a difficult journey. They often don't recover well. They're not re-engaging with school or employment. They're not overcoming their social exclusion. So we have to think about, what's the purpose of our efforts and what should we be doing? And so this is just a summary of some of the things we know. Right? We wait too long to help young people. We shouldn't be waiting till they're 16. We need to take account of difference, that this is important. The fact is that Indigenous people in Canada are, overrepresented. LGBTQ2S people are overrepresented. Black people are overrepresented amongst the homeless population. So these are important. And if you look at the 4th one there, our emergency response does not prevent or end youth homelessness. This is how we respond to homelessness in Canada now. Just a sec, I'm going to keep track of time here. There are three things you can do. You can focus on prevention, so try to stop things from happening in the first place. That's what we're doing with the pandemic. There's an emergency response, so shelters, that kind of thing. And then there's housing and supports, getting people out of homelessness and making sure they get housing and supports they need. The bulk of our investment is in that middle part, right? The emergency services, not just shelters, but soup kitchens, that kind of thing, but also, healthcare, law enforcement, these kinds of things all go into that cost. We're moving more in the direction of helping people exit homelessness through things like Housing First, but almost nothing about prevention, which is very odd. Can you imagine in the context of the pandemic if we said, we're not going to do anything about prevention, forget vaccines, social distancing, masks, we're just going to build a really big emergency room at the hospital. People would say you're crazy, unless you're in Florida or something like that. Anyway, let's look at homelessness in the criminal justice system, right? There are things that we know from research, and these things many of you will be familiar with. There's a bidirectional relationship between homelessness and involvement with the criminal justice system. In other words, being homeless means you're going to have more criminal justice involvement, and being involved in the justice system increases your risk of becoming homeless. So there's a cycle there where there are certain points at which we could intervene to disrupt that cycle. So here's some data from the United States. It was in a report by the Urban Institute that shows that people who are incarcerated are more than once, are 13 times more likely to experience homelessness than the general public. Right? So that's an important piece of information, which suggests, is there a role in our criminal justice response to helping ensure people don't become homeless when they re-enter or are discharged or etc. On the other hand, people experiencing unsheltered homelessness are more likely to have involvement with the criminal justice system than people who are in shelters. And so we have growing populations of people who are not going into shelters, in some cases for very good reasons. We've seen growth in encampments across Canada, that kind of thing. And the reason is, again, that they're spending much more of their time in public spaces. So why is there this relationship here? I think we need to take account of the fact that the status of being homeless carries with it great stigma. There's lots of victim blaming that goes on. Why are people so lazy? Why don't they just get a job? At parties, people come up to me with solutions like, what we need to do? We need to get people who are homeless to want to have a home. And it's like all of those things are wrong, but they're dangerous. We need to think about that intersectionality. The fact that people who are Indigenous and people who are Black are not only more likely to be homeless, they're also more likely to be involved in the criminal justice system. We have contested notions of public space. The word public isn't all that it seems to be. Public space is for some members of the public some of the time, but not for everyone. People who are homeless have lack of private space. We mentioned that before, which means they're forced to do things in public context. Lack of access to treatment. That's a huge issue in this country. And from that story, right, it's, it can take many episodes of treatment before there's success. And also if we look at stages of change theory, like, you can't necessarily force people into treatment if they're not ready, that kind of thing. We have to think about how that relationship between discharging people from prison, releasing them without any transitional supports, is that good policy when we know that discharging prisoners into homelessness is correlated with recidivism, which means that from a public policy perspective, lack of transitional supports is actually an investment in the production of crime rather than its reduction. And I mentioned lack of access to treatment again. I guess that means it's very important. Okay, so let's talk about the criminalization of homelessness in Canada. This is a concept that basically refers to an element of our response to homelessness, which in many ways we're criminalizing it, right? We use law enforcement as a way to respond to what is essentially an economic and social problem. So when we talk about criminalization of homelessness, there are different elements of it, right? So one is the enactment of new laws and statutes that are designed to curtail or restrict the activities of people who are homeless. So things like the Safe Streets Act, which has its 21st birthday this year in Ontario, a terrible piece of legislation that was passed under Mike Harris. When they were first elected, the Harris Tories, the first thing they did is got rid of photo radar, so concerned with people's right to break laws on the streets. And when they were elected the second time, the first enacted legislation was the Safe Streets Act, which basically set out to restrict panhandling and squeegeeing. The second thing is the disproportionate and discriminatory enforcement of existing laws. Like, the sad thing about the Safe Streets Act is that there are all kinds of laws on the books for misdemeanors that can be used to harass and intimidate people who are homeless, and they get used. You know, we've done research on ticketing, and young people are more likely to get ticketing for things like loitering or jaywalking or things like that or drinking in a park than the Safe Streets Act, right? So the point is that they get lots of tickets. Manipulation of the physical environment to discourage its use by people who are homeless. So in Toronto, about 10 years ago, we had a lot of vents from high-rise buildings in the downtown area that vented onto the sidewalks. You could walk across the grates, that kind of thing. The city actually spent money moving those vents from the sidewalks into the streets so that people who were homeless couldn't sleep on them, which, if they had taken that money and enabled people to get housing, it would have had better outcomes. Okay, increased surveillance and policing in public spaces by police and private security. This is something that we know is true. Increased incarceration of people who are homeless, right? So as a response, and sometimes that's for, it's for a full range of things. And then discharging prisoners into homelessness. So a lot of these things here are, again, touch points where we need to think about, like, could we do this differently? So how do we get here? Again, this is the Canadian response to homelessness. It makes homelessness a visible problem. And the emergency response includes, as I said, shelters and drop-ins, soup kitchens, special programs, but it also involves, in some jurisdictions more than others, certainly in the city of Toronto, the use of policing and law enforcement has been a major, major factor in how we respond to homelessness. And again, it comes back to stigma, which I mentioned, that it isn't just, the police aren't just operating on their own whim. There's a lot of public backlash against homelessness, and always has been, or at least since the 90s, where people don't want to see people are homeless. I remember in the 90s, people say, hearing reports, people from Buffalo don't want to come shopping in Toronto because there's so many homeless people, which I always thought, that's a bit odd. Like, seriously, from Buffalo, they're afraid of seeing homeless people. But the idea is that, people who are homeless are to be distrusted and are criminally involved, and these kind of things go way back historically, right? So our notions of youth, if you think of, even literature from Charles Dickens on, that kind of frames young people as being involved in these kind of situations, we need to be wary of them. So the other thing that happens is, in the 1990s, was a moral panic, right? So we had, as I said, the arrival of modern mass homelessness, which meant there were a lot more people on the streets who were homeless, a lot more people sitting on sidewalks, a lot more people panhandling. And then there was squeegeeing that emerged as a new phenomenon. So the visibility of homelessness increased dramatically. And so we started to see political responses the premier saying that they're nothing but thugs, who have to declare war on squeegee kids, and Mayor Mel Lastman. Remember the time when people thought he was the worst possible mayor we could have, and then things got worse in the last decade. So anyway, you had the politicians speaking out, saying this is a nuisance, it's bad for business, it's bad for people, it's a safety issue, I'm afraid to walk down the street, we have to do something. So the province introduced the Safe Streets Act, which at the time, they've changed they've edited the document or revised it several times, but at that time it had things such as people who are panhandling near transit stops or banks or anywhere where the public frequents are subject to the law. Like anywhere that the public frequents is kind of means everywhere. So it was a law that didn't use the word homelessness, but was absolutely intended and targeted at people experiencing homelessness. So we did some research on the criminalization of youth homelessness about 10 years ago, and through Freedom of Information, we got access to ticketing data from Toronto Police Services, which was quite interesting. And so we interviewed a large number of young people and did surveys with 240 youth. We did qualitative observations. We worked with Justice for Children and Youth, a great organization, and did an analysis of the data. And so here are some of the key findings. So we didn't just go out there to say, like, what are the police doing that's wrong? We wanted to get a full picture of the kinds of things that kinds of encounters young people had with police, and so there, of that 240 young people, 25% had encounters with police when they were a victim of a crime. That doesn't necessarily mean they went and sought the support of the police. Of course, police show up at crime scenes, and then 13.6 when police stopped to help, right? So they would offer to drive them somewhere or get them food or take them to a shelter. So there are some positive interactions there for sure. But there's also a lot of not so positive interactions. So, almost 4/5 of young people reported some kind of encounter with police. Most of these they described as negative. 60% reported a stop and search in the past 12 months. And the other thing is they were receiving large numbers of tickets. At least 33% reported receiving at least one ticket in the past 12 months. 16.5% received more than one, and some had tickets in the hundreds. Most were for drinking in public and loitering. And ask yourself, when was last time you received a ticket? And when was the last time you received a ticket that had nothing to do with automobile? The last ticket I received was about 3 years ago for speeding, and I've never received a ticket for jaywalking, which I have done. I'm looking around making sure no one's writing that down. Or, loitering, I suppose that's a pretty squishy term, right? So there's a lot of attention put on people. And one has to think about how and why this is justified when in criminal law in Canada, my understanding is, at least at this time when we did the research, was that police were expected to not ticket people if they felt there was very little chance that people could pay it, right? So don't use ticketing for people who have no money. And so there's an irony when we give tickets to people for panhandling. People are panhandling basically to get food or whatever they need, and now they have to pay a fine, and the tickets accumulate, and so it's quite harmful, right? So since the Safe Streets Act was enacted in 2000, the following 10 years, we saw a decline in panhandling and squeegeeing. So one could argue that the act had a deterrent effect, right? So on those terms, was it successful? I guess you could say that, right? So we had a drop in panhandling and squeeging, quite significant drop, both from our research, but also from City of Toronto research. Um, so one would expect that over time, as the number of um, people who are panhandling and squeegeeing declines, you would see a decline in the amount of tickets being issued. But what you in fact see is quite the opposite. So this is over an 11-year period, right? So in 2000, they were issuing about 750. They issued about 750 tickets under the Safe Streets Act. By 2005, it rose up to over 3,000. That was, some speculate that was driven by the fact there was a murder that somebody who was homeless committed, and then it became another moral panic that people who are homeless are murderers. And then you can see that by 2010, 15,000 Safe Streets Act tickets were issued. 15,000. So totally disproportionate response to what was actually happening on the ground. And so one has to ask, why? Is ticketing to address the offenses of people, or is it more a status offense that tickets are issued as a way of intimidating and harassing people in public spaces so that they move on? And so, this is then I think a serious problem and a question about not just policy but practice. Disproportionate use of law enforcement with people who are marginalized. And it's, as we're well aware, this isn't just the case with people who are homeless, but it's also the case with people who are Black in Canada and people who are Indigenous. And there's an intersection there as well between all three of those groups. So, okay. So what is the cost of the Safe Streets Act? Right. So we did some calculations, between 2000 and 2010, 67,000 tickets were issued in the City of Toronto for Safe Streets Act violations. 67,000. It's worth noting on a given night in Toronto now the population is around 7,000 people are homeless. So a lot of tickets being issued. The minimum value, now there's a range that you could use for the issuing tickets, but the minimum value I think at that time was about $70. So the minimum value of those tickets was $4 million. So that's $4 million of debt that is thrust upon people who do not have the means to pay that debt. And the cost of issuing at a minimum, this is just for the policing part, not having to do with anything once it goes into a court system. But the cost, and we calculated for 15 minutes of police interaction, which is probably we don't know how much. So anyway, it was almost $1 million of Toronto Police Services to issue these Safe Streets Act tickets. That's a lot of money that could be used to do other things, right? So there's an opportunity cost there that needs to be addressed. So there are other costs, though, that go with encounters with the police. Many people received a ton of tickets, other people didn't, but there is a smaller group that received a huge amount of tickets. That debt accumulates, and what the city does is after a certain period of time, a month or two, I can't recall the exact, the city sells the debt to collectors who will go and find people. So you imagine a scenario then where a person who's homeless wants to rent a place. They can't rent a place now because they need a credit check and they have a lot of debt, right? So you manage to get a landlord to take the person in. In spite of that, 2 weeks after they're housed, there's a knock on the door and someone says, you owe $4,400 for your tickets. You can't get a driver's license. There's all kinds of things then that come from that. And so the experience itself can be traumatizing. Many young people who experience homelessness never had any encounters with police until they were homeless. So this is a real problem in terms of how we respond to homelessness, right? And so, how do we come to this? So, we talked a bit about some of the things like stigma, political pressure to make homelessness less visible. Often there's a real effort to get rid of street homelessness, inadequacy of our response to homelessness. If we didn't treat homelessness the way we do, we wouldn't have to criminalize it. Gentrification pressures, of course, in Toronto are real and huge. And so these are a number of factors that go into it. But the social profiling piece is really important to consider. You know, that being homeless and recognized as being homeless by the Toronto Police Services or other police services is a factor then that can lead to more engagement and more negative encounters. And it's young people who experience homelessness see it as unfair, right? They see it as scary, threatening, and not helpful. It's hard to tell someone don't drink in public when they don't have access to private places to consume substances. Now, I'm wrapping up here soon, but and then we can have some questions. But I'm just going to stop on this quote from the speech from Jim Flaherty, who was Attorney General at that time, when they were introducing the Safe Streets Act legislation. He said, "Our government believes that all people in Ontario have the right to drive on the roads, walk down the street, or go to public places without being or feeling intimidated. They must be able to carry out their daily activities without fear. When they're not able to do so, it's time for government to act." Now, at first glance, that makes sense, right? Like, of course, people should be able to drive down the streets and walk down the streets, these kinds of things. And we don't want people to be afraid, right? But it's actually, the statement is highly problematic, right? If I'm afraid of walking down the streets in Toronto because of the people that I'm going to encounter, the color of their skin is different than mine, or the clothes that they wear are different, or their hygiene is different, and that scares me, I believe that law enforcement has absolutely no obligation, zero obligation, to address my fears by harassing people, by arresting them, by issuing tickets. There's a false logic there that underlies that. And we cannot let fear of people who are homeless or fear of people who are Black or Indigenous drive our policy or our practices. We're doing things in a very harmful way when we take that perspective. So I'll end here by going back to our response to homelessness. This is our current response, as I said, and it produces all these unintended consequences. And what we need to think about is, what if we did things a bit differently? Now, we'll always need the emergency response. That compelling story of the person with the lived experience at the beginning showed that, people are going to have things that happen in their life that are going to lead them into homelessness, regardless of how well we do on prevention. So we'll always need that. But we need to do a better job of helping people exit homelessness with housing and supports, right? People do better when they're housed and have supports, including dealing with substance use disorders, right? Like, I think it's incredibly problematic for people to deal with, if they have substance use disorders, to deal with them when they're homeless, when they're in crisis, when they don't feel safe, when they're experiencing trauma, right? When their life is inherently unstable. You're not going to get good outcomes when people are in that situation. However, if you provide them with housing with no preconditions, right? So not saying you have to instantly be in an abstinence-only situation, because for people with substance use disorders, that's a setup, that will lead them to fail. But give people the supports they need, including access to treatment. But give them the supports, money, help them re-engage, help them overcome trauma, right? You're not going to get to the bottom of the substance use disorder if we don't, practice trauma-informed care. But we also need to focus on prevention, something which in North America is a dirty word for some reason. We do very little on prevention in Canada and the United States. Other countries focus their whole homelessness strategy on prevention, right? So when somebody like our person with lived experience has that situation where they're in trouble and they wind up losing their home and their housing and things like that, or even for people without substance use disorders, when people get evicted or their relationship breaks up or a young person has a fight with their family, we should find ways to make sure that their situation gets supported and that they don't wind up homeless. Because that research that I showed you at the beginning shows that when we expose people to homelessness for any length of time, things get a lot worse, including substance use problems. So if we could switch around how we respond to homelessness in Canada, we would have much better outcomes. And we need to give people the supports that they need to get, to overcome the challenges. But they can only really do that if we ensure that everyone has the housing that they need. And the question that many people would say is, well, won't that cost a lot of money? Well, there's a research done by Eric Latimer, an economist in McGill, who looked at 5 Canadian cities. What does it cost annually to keep a person in a state of homelessness? And in Toronto, the figure was $59,000 per person to keep people in a state of homelessness. So that means the funding for the emergency shelter system and homelessness response services. It means the funding for higher use of hospitals, particularly through the emergency room door, which is the most expensive gateway to the healthcare system. It means the cost of law enforcement and policing. Our current response to homelessness, that emergency response, is actually very expensive. For $59,000, you can get someone housed and also provide them with a whole lot of supports. Now, sure, they'll still use the healthcare system, but it won't always be through the emergency room door. So we can solve this problem of homelessness if we choose to. It's about our priorities. It's about fixing our public systems. It's about being innovative in the way that, the issues that you're going to be talking about today. It's about dealing and giving people the supports they need. We can do it, and actually we can afford to do it. We just have to have the will. So now I can open it up to any questions that people may have.
Thank you very much, Stephen. That was extremely informative. We just have a couple comments in the Q&A that I'm going to just read out. I think these are both very similar in nature in regards to perhaps stigma that we experience, especially as individuals who have access to housing. What does it look like when we're coming face to face with these individuals, let's say in Toronto, on the streets? So the first one is, you assume it is skin color or hygiene that people are afraid of. It is the aggression invading personal space that people are afraid of. Homeless people should not be harassed, obviously, but neither should anyone else.
Oh, I agree with that, right?
Mhm.
I agree with that. And there are definitely cases of harassment. But we need to be careful not to generalize that to all people who are homeless, right? And so nobody should have to endure harassment or any kind of physical violence. But as I showed, I have other data that shows, as I said, that young people who are homeless are much more likely to be victims of crime than perpetrators, right? But if we're afraid of people sitting on sidewalks, we should be asking the question, like, where else should they sit? And where else should they be? They're on sidewalks because they don't have other places to be.
Absolutely.
So if a person who's homeless is committing a crime, of course we need law enforcement, but we have to really ask, are the things that people get fines for that are mostly the outcome of the fact that people don't have private space, is that justifiable? And does it make sense from a law enforcement perspective to to create financial hardship for people who have no money, right? And so, so certainly we need to balance, but we have to be very careful not to generalize. Not every person who's homeless is shouting out loud walking down the street.
Mm-hmm. Mm-hmm.
And they're there. I know that myself, right? But that's not every person who's homeless. In fact, it's a very small minority. And we want to be very careful to pass laws based on the actions of a small minority and apply to everyone, right? So
Absolutely.
if there's a crooked businessman out there, should we, apply major fines to all business people
Mm-hmm.
because of the one or the small amount? So
Absolutely. Being mindful of our own biases and own stigmas as we're approaching these individuals and keeping in mind their situation as well. Thank you very much, Stephen. We appreciate all the information provided today.
thank you.
Take good care.
Okay, bye.
Goodbye.